April's Oral Cancer Month, and that's it's something that everybody should know about. The majority of our patients don't even think about it, and actually only 25% of hygienists actually look for it. So at the end of the day, we got to look back at ourselves and be like, what are we doing to educate our patients?
There's folks on social media that do a really good job posting research, and I think we need to stop reactionary social media posts. Like, getting angry with people does no good. Starting a fight with people and telling them they're extra for doing their job is no good.
It's all about continue to evolve and grow, and just don't stay behind in the information that you are, just because you're in this little box in that particular office that maybe there's no other way out. You're just there. Grow and develop and create value for your profession. That's the only way that us as a profession are continue to grow who we are, and people are going to respect us out there.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 326. I am your host, Andrew Johnston, and have we got a great episode for you today. In today's episode, you're going to hear a group discussion on what is wrong with dentistry. And I know that, the list is so much longer for what is wrong with dentistry than what is right in dentistry, but we have to have a starting point, and so this is what that conversation looks like. If you enjoyed last week's episode, then there's a good chance that you'll enjoy this one, because our friends Emily Boge and Misty Mattingly are back, and they are joined by the Rafael Rondon. And so this was also recorded at the Hinman meeting, so expect to hear the sounds of the exhibit hall in the background. I really like those sounds, but I know sometimes it can be a little bit distracting, so I kind of want to give you a heads up. Before we get into the discussion, though, I just want to say what a great week I've had personally. This past week has been awesome. It feels like, I guess most of the time when I look back on my week, I always pick it apart, right? Like I say, I could have done that better. I should have worked on that. I should have put more time on that project or whatever. I feel like I'm pretty rough on myself. But this last week, I feel like super accomplished. I feel like we had really big team wins this past week. I feel like the people that I get to work with every day are just phenomenal, amazing, fun to work with. I even got caught up on watching Ozark. If it's a series on Netflix, if you have no idea what that is, but I'm super excited because I'm all caught up, and I think they're releasing the last part of the series finale, the last several episodes, at the end of this month of April. So I can't wait for that. I do keep hearing, by the way, about another show, Yellowstone. I'm not sure if it's just my circle of friends that are all about this or whatnot, but if you have a strong opinion one way or another, if I need to watch that show, send me an email, andrew@ataleoftwohygienists.com, and let me know. I think it's on the Peacock Network, which I think is surprisingly one of the few streaming services we don't have yet. So if it's really worth it, then we'll probably do that streaming service as well. I'll probably have to go through and see the ones that we're not using and cut away one to add the other one, but... what else? So for next week's show, we're kind of going to go into a different direction, and we're talking about the keto diet with the ketodontist, Dr. Matt Standridge. If that name sounds familiar, you probably remember him from episode 316 that happened earlier this year, and he talked about ortho. So having struggled with my own weight for most of my life, I was really interested to hear kind of what he had to say about the keto diet, because I feel like there are several camps for dieting and weight loss. And people who do keto almost seem like they were the same ones that were into CrossFit. Not saying that people do CrossFit do keto, but kind of like that super loyal, they're vocal advocates. They're a little bit intimidating because they love it so much. And then when I dabbled in it before, I experienced that keto flu, which he does talk a little bit about in the episode. And I really didn't like that, so I stopped. But I really wish I would have had a coach, or I wish I should have kind of went into a different direction with it and embraced it better. Because I was really all about kind of what he was saying with keto. I think there were just, because when I stopped, there were several benefits that I didn't know about if I would have kept going. And these are benefits outside of weight loss. And so make sure you tune into what he has to say about those benefits. Hit that subscribe button so you don't miss any of that episode. It was really fun, and I really enjoyed it. I also wanted to remind you all of several conferences that are coming up. They're coming up in the summer. So if they're not on your radar yet, make sure that you put them on your radar. If you need to ask for vacation time, make sure you're scheduling that out. But Europerio is coming up in June in Copenhagen. And this is one of my favorite conferences of all time. It feels very complete, the conference does. I'm still on the fence on if I'm going to be able to make it or not. I have some work obligations I'm not really sure I can work around, but I really think it'd be a good experience, especially those listeners tuning in from Europe. I'm talking to you. There's almost zero excuse to miss that one. It's very, very, very well worth the cost of attending. Also, RDH Under One Roof this year is in my backyard in Orlando, Florida. I will tell you that the Gaylord is an amazing location, and we've been to Gaylords before with RDH Under One Roof, but this specific one is a really good one. There's like a water park and all sorts of other things there. It feels a little bit bigger than some of the other Gaylords because it's just more inclusive. So make sure you bring the kids or your significant other because there's going to be plenty for them to do while you're in the classes. And then, of course, there's always the stuff that we get to do after the classes are over too, all the networking events and what have you. It's also only about, I think it's an hour from the beaches in the Cape Canaveral area. So if you're going east to the Atlantic Ocean side, and then if you were to go down and go to the Gulf side, to the Tampa area, it's about 1 hour and 45 minutes. Kind of depends on traffic. Probably more like 2 hours and 15 minutes to get to those powdery white sandy beaches of Clearwater. And that's like on everyone's best beaches list. So if you're interested in doing that, taking a couple extra days off and experiencing that, I think, RDH Under One Roof is a good conference to get that excuse. We don't have a promo code this year specific for ATOTH for a discount for RDH Under One Roof, but if you email me, message me on Facebook, I have a code that I can get you for $75 off a registration. And then lastly, in August, there is a conference in Dublin, Ireland for the International Federation of Dental Hygienists. It's the symposium. If you're looking for an excuse to travel outside of the US, and if August is a good time for you to get away, be sure to check that one out. Of course, we'll put the links for all of these conferences in the show notes for this episode. You can also go ahead and just Google all of them. They're easy to find. I'm hoping that next week we'll have a new theme song and transition in place for you all to hear. And I say this, again, I know I've brought it up a couple of times, but I say this because I really want to prepare you for the change. It is a lot different. It's a lot more whimsical. My hope is that with this new... It's 30 seconds, everyone. It's not going to be that big of a deal. I think I'm building it up bigger than it needs to be. But I think that my hope is that it'll set the tone for a more fun learning environment and kind of loosen us up a little bit and just kind of have like that childlike whimsy for the episode. So that's kind of what I'm hoping for with the new music and the transitions. That may or may not translate. Well, I guess we'll find out, won't we? So that is it for me. Thank you so much for listening and supporting what we're doing here. I hope you have a great week and enjoy this roundtable. All right, welcome everyone to the interview portion of this podcast. We are so happy to be here today at the Hinman Conference.
Woohoo!
Good sound effects. I like this is Misty. She's gonna be doing some sound effects and some singing for us apparently all throughout this year episode. We're with Rafael and Emily as well. Today we're going to do a roundtable, and what I thought would be an interesting topic is what is wrong with dentistry? Crickets. Nothing's wrong. Okay. So, but also,
24 hours later.
And I still think this is stupid. Yeah.
There's so much.
And so the thing is, like, this conversation could go really negative really quickly, and I don't think that any of us are really negative people.
Correct.
No.
And so let's talk about some of those things honestly, but what are we doing to improve the profession, and what are things that could be improved, and how can we do that? So I don't care who goes first, let's throw out a topic of what is wrong with dentistry currently.
I got a big topic.
I'm sure you do.
You know I do.
Go for
I
it.
always got to pick a topic. Oversaturation in urban areas and undersaturation in rural areas. Because I'll bring it from Iowa. I will.
Of course.
I will.
That's right.
So are you saying, though, that just hygienists or all dental professionals?
All dental professionals. So you have these rural areas that folks have to travel hour and a half to get care. And then you got these urban areas where it's a dentist office and then a dentist office and then a dentist office. And on the next block, there's a dentist office. And so I think that's kind of where to start, because it used to be that dentists kind of went back maybe to their hometown, and with the mobility of society, it seems like everybody wants to live in the city anymore.
So let's talk about that, because I feel like on the other podcast, Dentist Implants and Worms, they're from South Dakota, and they're always trying to find associates, and like, look, guaranteed starting $350.
Yeah.
Like, we will pay out the wazoo. There's money to be made, and so money isn't necessarily always the motivating factor for this issue. I don't feel like.
No, it's not. It's about, it's about like where they want to live and be. And I think that, in Georgia especially, I mean, we do have some shortage areas in the state, in the South. I mean, I think right now we have around 127 counties that are considered to be a shortage of dentists, dental shortage areas. But it is a struggle to get people out to the rural areas. And I think it's not, you're right, it's not about money. It's about they want, that mobility as far as like restaurants and, nightlife and all those type things. But I think that, and it used to be that people lived in the cities, right? And so that's where people lived, that's where people worked. But I think now that you're starting to see us transition with 2020 and COVID, right? Like people started moving out. So like here in Atlanta, like everybody used to live in the city, and now we have this big boost of everybody moving out to the suburbs and even out further out. And a lot of it has to do with the fact that people can now work anywhere. Yeah. So, I mean, I think that I hope what we'll see is that more people are going to go out further and kind of because they can kind of work anywhere. And then those areas will kind of grow up and develop as well, and that will kind of help. But I think, it is tough to get providers to go out there. And I think we could offer, as far as, I know where I've worked in the past, we've offered things like to pay their student loans and relocation and things like that, so you can do that. I don't know. You need to get one of those, what's that Netflix show where the girl goes out into the rural area to work, and she's like, it's the hot guy, so you got to have all the hot guys in the rural areas.
Are there hot
what I'm
guys?
talking about? There's
my gosh.
I'm
There's
kidding
hot
with
guys
you,
for days. And one thing I've heard dental professionals
Virgin
say,
River is what it's called. Virgin River.
I need to watch more TV.
You know what I'm talking about?
I never get the references unless it's like a Yellowstone reference, and I always get it. So I hear people, one of the justifications that people give for not wanting to live in the rural areas is, I come out of school, I have all this debt, and I need to pay it back, and I need to make money. Well, I worked in a rural practice for 12 years before I went into education, and we saw a patient base of like 8,000 in a town of like 4,000. Wow. And we made some profit. We were a very profitable practice, but we were a very good, efficiently run practice. And I think, for the amount of people in the rural areas that don't have insurance, you don't have to have all those write-offs. Oh, no. So you can't tell me you're not going to make the money in the rural areas because it's there. And I think, there's so many layers to it. But I will say all of my students last year had jobs before they graduated.
Wow.
Right.
Wow.
And so I don't know, those who are listening, if you don't know my background, I run a dental hygiene and dental assisting program in central Iowa, and both of my programs are accredited, fantastic faculty, but I drive about an hour and 15 minutes one way to get to school because my husband farms, and that's how it is. But, this rural issue, I think, is one issue that we're seeing because when people talk about, like Misty said, with the shortage of care and in the underserved areas, there has to be a reason for that.
Is there a perception from dental professionals that if we go out into the middle of nowhere, then we're going to have really, crappy offices with none of the updates, still being used paper charts? I mean,
there is a perception of that, but I'll tell you what, our office was one of the first offices in the state of Iowa with CBCT.
Wow.
And electronic charts and digital x-rays and all of that stuff. Lasers. I've been doing laser care. People talk about laser care like it's a new thing. I've been doing it since 2009.
Wow.
I mean, it's like you are what you choose to be. And it's just,
And do you feel
Kudos to Iowa. shall I say.
definitely? Do you feel also, and I just thought of this, that it could be also dentists and even hygienists moving to those areas feel like every patient that's going to walk through is going to say no because they feel just extract all my teeth. I'm not going to do that.
Right, that whole lack of preventive focus for the patient population. And you know what? Sometimes you see offices close, and then you see a certain office's patients be seen in an office that does perio care and be seen in an office that, wants to restore and, do implants and have that person have a functional mouth and a happier, healthier life. And the patient looks at you like, oh my gosh, you can do that? And I think you can focus on the negative of, I don't want to see these patients that don't have that perception, but you'd be surprised the value people put on care when you explain care to them.
Oh, absolutely.
Yeah, definitely.
Absolutely.
I think that's everywhere. I think that's happening everywhere when it comes to even in the cities. It's education.
Well,
once you go into that level of education and teaching them and letting them know what's going on, patients are more open to saying yes.
Right. Well, and that's one of the things we do wrong, you guys, is that we don't educate. As far as dentistry, we don't really educate the public as well about, their care. I mean, I keep looking back at us, like, April's Oral Cancer Month, and that's like it's something that everybody should know about. The majority of our patients don't even think about it, and actually only 25% of hygienists actually look for it.
Yeah.
So at the end of the day, we got to look back at ourselves and be like, what are we doing to educate our patients? And then too, I mean, I always look to like the big dogs, like Crest, Colgate, all those, right? Like those are like, or Butler, those, what are they doing to help educate the public? Because they have these commercials and stuff. Like, what could they do to help us educate on oral health out there? Because I think we just don't do a really good job of that in our field.
Do you mind if I put a pin in this one? Because we're going into a whole different problem.
Yeah.
I just want to finish the thing where the hygienist listening to this, or maybe the soon-to-be grad is saying, all right, everyone, you guys convinced me to move out to a rural area.
Yeah.
How do I do that?
Let's do it.
So I get 3 to 5 calls per week of people looking for hygienists in my community. And so I run 3 different pages where I post free job ads for our dentists and our dental offices, the DSOs in our area as a service to the state, right? So I put these ads up, and they just want people to come and move and work, and they're willing to pay for it. I mean, these are decent jobs. And it's interesting to me, I'm starting to see a fairly higher wage being offered in these rural offices, because once people relocate there and they establish a patient base, that doctor does not want to lose them. One of the number one things that dentists are fearful of, I can't remember what survey it was, but one of the top things, I think it was number 2, was losing their hygienist. And so you get an established hygienist in these offices, and they don't want to lose them, and the sense of community that they build. And so I think you get the student or the new graduate or the relocated hygienist to the community, they build a reputation. One of the things that I've done is I post it on our internal site. We have an alumni page for our dental hygiene school, and we also have the Iowa Dental Hygienists Association page that my friend runs, so I kind of filter those ads to her too. And so connecting the people with the jobs is critical.
Yeah. Okay, so let's go back to the next problem we were talking about. We were talking about the problem of the public not being educated and kind of our liability in that, because I feel like any commercial, I'm just thinking about like how do we get to the masses? We have these nationwide ad campaigns that are put on by the big companies, the Crest and Colgates, and it's always about toothpaste.
Correct. Yeah.
I mean, it's this one such a
it's like putting lipstick on a pig.
Yeah.
Right? Like, I mean, because toothpaste, it's sorry, I had to use a farm analogy.
Oh, yeah.
She's like, I got you. I know what you're talking about.
She's like, I got you back.
Yeah, she's got me. So, but no, I mean, it is, because it's like you can use whatever toothpaste, but if you have an underlying issue, it has to be addressed. So let's talk about the real issue. Let's talk about why people have bad breath, right? Let's get to what's the cause of it. Let's get to, what causes decay even, right? Like,
I think there should be a national ad campaign that they should put in every Walgreens toothpaste aisle that said, you don't need whitening toothpaste. Because they put whitening on every damn dang
But
box.
they do need charcoal
Yeah.
toothpaste. That's what
Yeah.
they really need, right?
And I'm sorry to interrupt you, but
No,
that just
no.
irritates the heck out of me that every toothpaste box says it whitens. You
Yeah,
know
it's all
what?
about
Show me the efficacy on that.
Yeah,
That's bogus,
definitely.
right?
Right.
And so, like you say,
Well, it whitens because it removes plaque.
Yeah,
And plaque's
yeah.
yellow.
Yeah, but I know where you guys are going, and I see that. Yes, there's different forms out there through Crest and Colgate, whoever's out there preaching when it comes to announcements. But I feel like we ourselves as providers devalue our profession. Starting from the moment that that person walks into the door, and we start not even probing, as simple as start with that process of assessing that patient to determine what's going to be the best treatment for that patient. And then if they need scaling and root planing, finding that hygienist got to probe, we tend to, no, I don't want that. I only want my insurance says, okay, let me do that prophy for you.
it's just a cleaning.
Yeah, we'll make it happen into doing that only. And we devalue who we are, and that also goes into
Well,
the
yeah.
dentist. From a crown, it becomes a filling because the patient said, no, I don't want that crown. We devalue the diagnosis to do the
Yeah.
right treatment because, that patient said, no, I can't pay that. I'm not going to pay that. That's not what I want. I want a filling.
Amen, Rafael.
We let them tell us
On.
how to treat our patients.
Oh, it's not on. Hold on. I got you. Hold up. I got one of these. Nope, not that one. Hold on. It's coming. Hold on. It's coming. Okay, it's not coming.
So
I had like these little sound effects. I was going to go like,
Oh, yeah. I was
I got you.
I
you.
even lost
Hold
my
on.
thought. But it's
it's not that. Oh, no, hold on.
We
No, that's the wrong one.
that's not it. The clapping.
both
There
are
you go.
appropriate. Both appropriate sound
They
effects.
are.
So when I was at IDS in 2019, I was just cruising through one of the booths, and I saw artificial intelligence in dentistry. So they had this booth where they had 3 dentists, and then they had the artificial intelligence that looked at the probing and looked at the health history and looked at the X-rays and everything.
Mm-hmm.
And the artificial intelligence came up with 3 treatment plans, and the 3 dentists came up with 3 treatment plans. And so I sat and I watched this for like an hour, and I'm just like, you gotta be kidding me.
It's incredible.
And so there was, I'm not gonna say what country this person was from, but they were right next to me, and they're like, this is amazing. And I'm like, I know it's amazing, but it would never work in the United States.
Yeah.
It wouldn't work because the computer would be saying all this stuff, and no one would admit to reality.
Right.
Mhm.
And I understand, professional opinion, and not everyone's going to say that. But, when I give my ethics course, I talk about how everyone forgets the assessment, the diagnosis, the planning, and the
Implementation.
patient sits in the chair, and all of a sudden we start implementing.
Yeah.
And it's like, hello, guys, there's a reason why it's a 6-step plan.
Yeah.
And you just skipped half of it. So how can you be effective when you're skipping half the plan?
Yeah.
And I just, finally people are starting to, I'm going to say, get in trouble for not assessing properly.
Yeah.
And I don't understand it. And it all starts with the fact that people are getting 30 minutes for a preventive care appointment,
Yeah,
which
that's
for
it.
sure.
blows my mind.
That does blow my mind. That kind of goes to, I see all these forums, back to our topic as far as what's wrong with the industry. And I see all these forums about, hygienists want to getting out of the op, or that
I can't stand
I know, or the whole thing about, you see these things about 30-minute prophies and, stuff like that. I think, and or not feeling respected. And, I wrote an article last month about that. It's about, we're starting to hear about shortages of hygienists. We talk about your lawyers. We're struggling here in the inner cities to get people to come out and work. And there is a shortage of hygienists, and one of the biggest things is that lack of respect. But I go back to us still.
Yeah.
I always feel like you teach people how to treat you, and that's something. And I feel like we have kind of got ourselves in this place because we haven't demanded that respect all these years of what we do. And like for instance, if you're willing to do that 30-minute appointment, right?
Yeah.
Then we hygienists, I'm just put us all together, we should have been the ones to say, no, our standard of care is an hour, and that's what we're going to require. But instead, we've had people that have compromised, what we went to school for, and said, no, I'll do it 30 minutes.
Nobody
or I'll
wants
see.
to work anymore. And I see it in the students, and I see, that this attrition, this great mass exodus from the workplace, they call it, the great exodus of 2021.
The great exodus of 2021, yeah.
And we see that in the schools now. I got an email from ADA a couple weeks ago saying that there were like 1,900 students down from
Wow.
how many people should be registered for the written board exam at this time.
Correct. No, that's what I
So-
said. We're going to have a huge shortage. And
So then here's what I did. I did the math. I know, shocker. I hate math, but I did the math. And I thought, okay, right now I have 14 seniors. I lost 6 seniors during the process, which is a big attrition number
that's
for
a big
us.
attrition. Yeah.
Right? So you say those 14
For 20.
seniors, I lost 6 people. Let's multiply 6 times 327 dental hygienist programs in the country. There's your 2,000 people right there.
Yeah.
Right.
So it's not that these people didn't apply to take their boards. It's that they don't exist.
Yeah.
Yeah.
And so you think the shortage is bad now.
Oh,
You just
that's what I keep
give it
saying.
3 years.
The shortage is going to be, so we saw an ADHA says and ADA says an 8% exodus, right?
Mm-hmm.
Now we have like a 10% decrease in school admissions, right?
yeah.
And or people that have decided, and it's because, and I see like these forums, right, where people always talk about these negative things. I'm like, can we talk about the positive? Because I love my profession, right? And, you know, we're going to really, it's going to make it harder for us. And we're going to now create another issue. And I don't even want to say what that issue will be if we continue to have a shortage of hygienists. Because ultimately, you know, we have a responsibility to care for people and to take care of them. And we know that there's so many links between oral care and, you know, the rest of the body. And so as we continue to grow in that area, I think hygienists are going to be needed more. But we've created this environment that honestly and truly, sometimes I feel like we created it ourselves. And I hate to say that.
Well, if the general public doesn't know who we are.
Right, that's what I mean. If
we
they don't
go
know who
away,
we are,
they're not going to care.
Yeah.
And, you know, it's very frustrating to me because you just, this whole just a hygienist, a perfect example of this, it was about 3 weeks ago. Somebody said something about oral cancer screenings on one of these, I'm not going to call out the Facebook forum, but on a Facebook forum. And I said, you know, I wrote this article and I linked to this article from Inside Dentistry from like 10 years ago that talks about the importance of an oral cancer screening and how it's 0.00005 of a dollar to buy a piece of gauze to do an oral cancer screening.
right.
And somebody replied to my comment of, that's just a little extra, isn't it? Like, that's extra to say dental hygienists should do an oral cancer screening. And all I commented back was, that is not extra. That is not
That's
extra.
the standard of care.
It is.
I mean, we're responsible for the head and neck.
Yes, it
It's
is.
not just the teeth. I mean, we're responsible for all that. I mean, I personally have, you know, in practicing, like found a basal cell carcinoma on somebody's ear. Like, that is not my, I mean, that's not the zone that I'm typically, but I really am responsible for head and neck.
Yeah.
But people don't even realize that hygienists are healthcare providers responsible for the head and neck.
Right.
So let's rein this back in just a little bit to solving the problem, though, too,
Yeah.
because I want to have solutions, definitely.
Yeah, absolutely.
So how do we get the public, the awareness, how do we get it so that the public is accepting us as medical professionals, healthcare professionals, and that also this is a viable job for people to go into. It's a viable profession for people to go into.
I think it's one of the greatest professions out there.
But how do we tell people that?
Yeah, and we're making a difference. I think it's telling people out there that it's not just in the mouth, because we know that this connection of the body and the mouth is always out there, and patients don't see it that way. We need to continue enforcing or informing patients out there that it's linked to heart disease, diabetes, and so many other systemic diseases, that if we start doing that, they're going to see it as more of a level of differences when it comes to what we're doing.
It starts in the schools. If we're not teaching
100%.
students total body health
Yes.
and the importance of total body health, they're not going. I think that our students, when they go out as new graduates, teach the offices just as much as we teach that student when they're in school. Because I'll get calls from dentists, so-and-so, you know, just started at our office and help me understand this, you know, XP technology. And they don't have to sharpen those instruments. Are you crazy? It's like, no, I'm not crazy. That technology's been around for a long time. And I can't blame them because you don't know what you don't know.
Right.
But at the same time, it has to start in the school. And if we are graduating the top quality graduates and they go out and they, you know, propagate what they learned in school,
Yes.
it can just continue to spread. And what happens a lot of times that I've seen is these students go out to the offices, they're excited about what they learn, they want to share what they learn, and somebody squishes them. Somebody says, oh, you must really like being a hygienist. Well, here we just use stainless steels and we sharpen them ourselves. Or we just use, oh, no, you don't need to, you don't need to use 2 wipes to wipe your room.
Yeah.
We just wipe it off. We don't wipe it off to clean and then wipe it off again to disinfect. And so it all comes back to, like, we can teach them everything that we know that they need to learn to graduate as entry level. But when those little birdies fly off, if they go out and they get into a situation where that opinion isn't respected, I think it does fall on the educators, but it also falls on the offices to accept.
Exactly.
I was going to say, like, that's – so 1 would be this, but I think 1A would be, our, like, DSOs very specifically, since there's just so many people going into DSOs right now, is that we're going to be able to continue enforcing what they learn in the school and supporting that, I think.
Well, and it's hard for me as a program director that depends on those dentists to help me with my job to say, well, actually, that is the standard of care now. Yeah. And actually, you do need to probe at least every year or every time with a perio maintenance patient. And so, I mean, I'm going to back my students and my graduates, but it's this constant balancing act. And you want to maintain positivity and support for everyone. But it takes a lot of my pullback sometimes to say, okay, they don't know what they don't know.
Yeah, that's it. And I feel like it's more about making sure that same value when you went in, or that caring and wanting to be a hygienist, you carry it over when you leave the school and continue elevating your profession, not bringing it down, not finding a way out even before sitting in the chair and being a hygienist. You're really thinking, okay, what way can I leave to be a mentor, to be a writer, to be a speaker? And we still haven't lived the life of a hygienist that knows and breathes that process. But it's the value part that you have to enforce within the office level for the team members to know, but at the same time with the patients that are coming to you.
You think about that hygiene flower from the old Wilkins textbook. You're always a clinician.
Yes.
Always.
When people say to my kids, what is your mom? Well, she's a dental hygienist. And people are like, well, what she works at the college. Well, she's a dental hygienist who happens to be an administrator at the college.
Yeah, that's
she's a dental hygienist who happens to have her doctorate. That's the thing. Like, gets me so frustrated. These hygienists, like, I'm gonna get on my soapbox just for a hot minute. These hygienists that come out and they're like, you need to be more than that. Yeah. It's like, no, I don't. I don't need to be more than that. And just my dissertation, I just finished it. It was the benefits of getting a bachelor's degree when at entry level is only an associate's. And it's going to be published, coming out here shortly. It's published online. It's just not in a hygiene publication yet. And one of the questions I got in my dissertation defense was, do you think everyone needs a bachelor's degree? And I said, that the profession is pushing pretty hard for bachelor's degree to be entry level so we can get, that professionalism respect. But ultimately, I think it's up to the person. Yeah. And not everyone needs it, but everyone can benefit from it. The critical thinking that you learn in a baccalaureate degree, we do not have the time. We have time to teach you critical thinking in hygiene school, like a traditional entry-level degree, but we just don't have the level that you can get if you have an extra year.
But it's only an extra year because, a lot of people always think, oh, it's just 2 years. But remember, you had to do lots of schooling before you could even get into hygiene school.
Yeah.
Right.
So it's so close to being a bachelor's. I honestly just wish some of the associate programs could just provide you, because it's really not a full year.
Yeah. Right.
It's really not. It's only just just another semester.
Exactly.
And everybody always thinks like hygienists and nurses that like nurses have a lot more education than we do on that entry level. But honestly, hygienists actually have more education than a nurse. But when you put the two together, everybody's going to think that the nurse has, if you ask somebody in the public, well, which one has the most education, in the entry level, they're going to say, oh, the nurse. Well, no, actually hygiene does.
But I feel like that's just because when they think about the job duties of a hygienist versus the job duties of a nurse, it's so expansive what they've seen a nurse do on TV, in the whatever, but then the hygienist is always sitting chairside.
Well, I think maybe we need a TV show where
I want a reality TV. I want a reality dentistry show.
Well, I'm being serious here.
That'd be amazing.
A TV show where a dental hygienist or a dentist isn't like the dentist in The Hangover that they make fun of, or the dentist on Bad Bosses that they make fun of.
Yeah.
And it's just it irritates me this perception. And so how do we stop this perception?
Well,
It's
it's
gonna
true.
take a lot
We
of
talk
time,
about
but-
we talk about hygiene, but dentists get it too, right?
Oh, yeah.
And
So much.
they're the same thing. Like, like you're right. Hangover. He's like, oh, he's a doctor, and they say, oh no, he's
Not
a
really,
dentist,
yeah.
right?
No,
No, not really.
If I
He's a
cut my
dentist.
head open, I guarantee you I'd call my dentist to sew it back up before I'd go to anybody else. Because the sutures in the mouth, I would rather have a dentist stitch me up any day.
yeah.
Because
Yeah.
the meticulous nature of the
Yes.
sutures in the mouth,
Yeah.
if you can suture in the mouth, you can suture, I
Yeah.
mean,
Yeah.
it just irritates me. And the lack of respect. And it's,
value.
I mean, unfortunately, we are what Hollywood portrays. So get a show where there's a dental hygienist who's a strong, successful male
Yeah.
who, like, let's
Thank you.
flip
Named
the
Raphael, and he
perception.
smells delicious.
I was just to say, Andrew, there you go. That's the next
Named
thing.
Andrew,
We're going
who
to
talks
start a
to me.
I'll
reality.
do some
podcast.
voiceover work maybe, but
Yes,
I
make it
I don't
happen.
like being on the screen. Okay, so I'm glad that we solved that problem. Just have a TV show. Boge, I wanted to
Check.
come back to the survey that I think you mentioned earlier about the dentists were so afraid of losing a hygienist. But if you on social media, everyone's like, screw hygienists. Like, I am so tired of my hygienist.
Maybe
Every
they don't
forum.
have the right hygienist.
That's it.
So I guess here's my thing. How do we control that perception of so many younger people are on social media and see those comments and think that that is the truth compared to surveys? So my problem is, how do we get people to look at real research and real surveys?
Every time I see a comment like that, I personal message that person and say, fire that person. Let them go. You know why? Because it's my firm belief, and I'll say it until I'm in the grave. It is better to have no one than to have the wrong person.
But I do want to go back to social media and that being the problem. So how do we get that though? How do we get? How do we find the good research?
Well, there's folks on social media that do a really good job posting research, and I think we need to stop reactionary social media posts. Like, getting angry with people does no
Yes.
good.
Yes.
Starting a fight with people and telling
Oh,
them
gosh.
they're extra for doing their job is no good. So don't just say, oh my gosh, that's a little extra, but tell me, okay, fine.
You're scarred by that, aren't
Yeah,
you?
I am.
Yeah.
It
Okay.
really irritated me because, like, that's the problem, I
Yeah.
think. The people who actually respect their own profession and do their job get shunned. And so when they talk about it,
Yes.
it gets shunned. And so
Well-
it's like 20% of the people that are being the, I don't want to say Karens of the world, but 20% of the people are making 80% of the people feel like they're not doing the correct thing.
Right.
Well, and I see that. I see that especially when it comes to, and I'll bring it up. You mentioned it early. DSOs growing. I see that a lot, where a lot of people are negative toward DSOs, which really adhere and keep those standards because they have to, right?
right.
But, I mean, it's the right thing, but also they have to because there's such a large,
They're
they're
being
larger
watched.
entities and they're being watched, right?
I
So-
used to be one of those people that was like DSO,
right?
and because I didn't understand it.
Sure.
I
Oh.
didn't take the time to understand it.
Right, and I've done some consulting, and whenever I've done consulting and even went in and evaluated and looked at some practices, I'll look at some things and I'll see x-rays, I'll see probing depths, I'll see the whole thing, and then I'll be like, oh my gosh, we've been doing a probe, and I'll literally like have a conversation with some of these individuals, and they're like, oh, well, that person, I just didn't want to have the conversation with them. And I'm like,
Devalue
no,
our profession.
that is
right there.
devaluing our profession because you are the person to have that conversation.
Yeah.
That is what makes it. And that's what I'm saying. Like, if you adhere to those things and it's just a matter of and you're not educating, then that's where we go wrong as healthcare professionals,
Yeah.
right?
And
Like,
that's
we have to be. And that's what happens, like what you're saying on social media, when somebody's questioning, oh, I went into, like, for instance, I saw one recently where the hygienist was saying, I went into this new grad, went into a practice, and they're wanting them to do like 30-minute appointments. And she's like, well, I don't have time to probe everybody and do my assessment. She's trying to do her 6 steps, right? And, people were like, oh, well, just clean them up, let them, and then other people were like, no, like, you need to
Tap the brakes.
tap the brakes and let's
Yes.
look and see the quality of care, right? Because you have a license to protect. And I think sometimes they all think, oh, I just work underneath the doctor's license. Well, no, you have a license as well. We are licensed professionals, and we need to ensure that we're providing a standard of care to our patients. And if that's being jeopardized, we need to speak up.
And it's the same thing. We're teaching our patients how to treat us.
Well, exactly
And
what I said.
it's the
You
same
teach
thing.
people how to
Like
treat you.
it's the same concept. Like the patient comes in, you're the professional. If you don't assess them and tell them what's really going on, they don't know. They don't sit there with an intraoral camera at home going, like, what's on the distal of 20, what, 24? You gotta, is that calculus down on the lower anterior? Or what's going on down there? No, they don't do that.
Yeah.
They don't do that.
Well, and that's why I like artificial intelligence.
Oh, I love it.
Because, and, it's something that we've been really working on and trying to implement in our locations. It's so important because it gives you, it's an opinion that's not the doctor. And two, I think with the patients, it actually helps because it's, it's saying, okay.
It's objective.
It's objective.
Totally.
It's an objective, and it's not based upon, like, how they always say, oh, the doctor just wants a new car.
Right.
Yeah.
Right?
Exactly.
Yeah.
So it's also like saying, hey, we ran your x-rays through these scans. This is some of the areas that it picked out. Now, our doctors have to agree with it too, right?
Right.
Like, and there are some things, just like Alexa or whatever. I mean, sometimes she gets stuff wrong, so we want their opinion.
Well, and you're
But-
not you're not
but
wanting that to be the doctor.
it's
a
not the
supplement.
doctor. It's
Yeah.
just a supplement to be able to say, hey, these things, and so much so, some of it is, like, for instance, recession, something, right? In the new guidelines, we need to be sure we're getting our clinical attachment loss,
yeah.
right? And what's really cool about it, some of these technologies, is they will actually show you that you had recession and that recession change, which we're measuring in millimeters, and it's measuring in like nanometers. All right.
I say that a lot of things, it's just a hygienist out there that is working somewhere that they're not letting the opportunity for them to do the right assessment when it comes to the caries assessment, the peri assessment, and it comes to an oral cancer screening. Leave that office, go somewhere else that you're going to be able to do that, because again, in that office, it's not letting you work to your full potential. It's not letting you do the right thing for that patient because it's a factory mill.
Yeah, and these hygienists are running from a scarcity mentality. They're so worried about their next paycheck that when I say things like that to them on social media, like, you need to leave. You don't have to leave today. Like, have a plan. Like,
Oh, but they can go anywhere now and work.
you can though, and
that's not as much of an issue.
you can, and it's so frustrating to see. It's just over and over and over the same cycle.
One thing I'd like to see as part of a solution to some of these things that we've been talking about, though, is when we have a new graduate or recent graduate, is giving them enough time. Because when we're talking about these, I don't want to have this conversation, it's not, maybe it is, maybe it's not. It's not so much I don't think I don't want to have this conversation. It's I don't know. I'm not equipped to have these conversations. I don't know how to do it skillfully. I don't know. I haven't had enough interactions with human beings in a public level to be able to have these conversations. And being someone who is very introverted myself, I remember those first couple of years where I'm like, okay, I'm just going to do whatever a doctor tells me to because, one, it's the scarcity mentality. I was never taught how to do it quickly and make it within my time frame. And it's just easier.
And if hygienists if they can't do it perfect, they don't want to do it.
Yeah.
And I hear that time and again. Well, I can't do it right, so
I can do a prophy right or whatever.
Right.
Yeah.
It's the other thing I see is the dentists that come into our practice that help in the clinic. So we have dentists from the community come in our dental assisting practice, and they do the restorative, and the assistants help them. When we introduce something new, like the new perio guidelines, some of those dentists were like, when did this happen?
Wow.
And it's hard for me to be like 4 years ago.
Oh, yeah.
But they're like, we have to stage and grade, and what in that? Can't we just say they're healthy? Well, do they fall under this healthy parameter? Well, no, they have one spot of recession. Well, then guess what? They don't.
Yeah.
So like educating the public, and sometimes people are a little stubborn to accept the changes as they occur. I'm going to try to be as generous as
I mean,
can.
I talk to hygienists all the time, and literally I'm like, are you familiar with the 2019 guidelines, the new AAP guidelines? They're like, huh?
Yeah.
But this is our profession, guys. That's what's wrong. We got it.
When
We
you
need to be
only
staying
do
more on top.
30 hours of CE every 2 years, like you have to do. You only do the minimum. You're only going to give your patients the minimum.
That's it.
That's fine if you want to do the minimum, but don't expect to give your patients more than the minimum.
And I believe a lot of hygienists out there sometimes feel like, oh, I know enough about perio, so I'm not even going to take that course.
Oh, yeah.
Not knowing that it changes now. There's a new conversation in that course now. And they go into things that they feel that they don't know because they know enough about perio. But if you go to their offices, You find no
Oh,
roving
and the
stuff.
new
You find-
classification, it's different. I mean, it's deep. I mean, it's
It's deep.
completely different. You have to really, and it really is more like the medical model, right? And so, which I think is great because that's helping dentistry get into the healthcare regime, right? And start looking at us, and we have to embrace those changes so we can be thought of as healthcare workers. Because if you went in and every single time you saw your patient and you staged and graded your patient and you said, oh, based on how you are today, this is your stage of your periodontal disease and this is your grade, I think they would start, because that's how the medical model does it.
I'll tell
They
you what,
stage and
I would
grade.
love it if we followed the medical model and people had to take boards every 5 years.
Ooh.
And people look at me like with daggers when I say that. But if we had to take boards every 5 years,
I would like that so much.
maybe
too.
I would.
I just
because
took one.
people
Me and
would,
you just took it not that
It
long
was
ago.
let's not get
people
on that.
would
That was
pay
the bonus thing,
attention in CEs.
Yeah.
People wouldn't be reading magazines. They wouldn't be on their phones. They would be engaged.
Yeah.
Continuing education would be relevant.
Yeah.
People wouldn't be giving the same continuing education program for 10 years. They wouldn't be watching a rerun program on the internet that was made 10 years ago.
Right.
They would have to stay relevant because guess what? They'd have to take the boards. And this is the first year that the boards are completely switched over to the new AAP guidelines.
Yes.
And I worry because I know there's schools that aren't teaching them. And so those
that's
students from
great.
those programs are going to get to the perio section of the boards and go, holy jeepers.
What is
like,
this?
Yeah,
what
'cause
is
it's,
this?
Oh yeah, because it's a lot.
It's a lot. It's a lot to take in when you have 2 years to learn it. But
Yeah.
it just makes me sad that like there's so many professionals out there who just have no idea what's going on.
So you're in and you're done. Like I think the whole board experience, I have a whole different soapbox for than this thing.
So do I.
It's just that it's not a continued. Doesn't Canada do the 5-year? Not necessarily boards, but they do like a 5-year
update.
check or something like that on their hygienist.
Yeah,
as
well, then you have to also think the boards are 5 years behind.
Yeah.
The boards are written 5 years behind.
Yeah.
So even when you take your boards, it's already 5 years old. So if you have to update every 5 years, it would be like you having the 10-year information.
Yeah.
Like,
yeah.
again, not good
Wow.
at math, but I can figure that out.
Good job, doctor.
Yeah.
Yeah,
you
good
are.
job, doctor. Dr. Boge.
We have time for one more complaint. I mean, one more issue. Issue
Let's
with
call it
dentistry.
a concern.
A concern.
A concern and a solution. Who has a good one?
I got one that we can talk about.
Yeah.
But we may have already talked about it a little bit. Just because I ran into somebody earlier, and they were actually, I told them what our topic was, and they brought it up. So I
good.
I
Shout
wish I
out-
could
shout
remember.
out to-
Wish I could remember her name because I
Whoever that
just met her. But she's from Athens. But the issue is the issue is that people coming out of school are wanting this
Greece. Isn't it Greece?
this crazy amount of money. And she's saying that, being a hygienist for a long time, she's not making that now, but she's hearing that the students are coming out requesting this major amount of money. And she's also concerned at the fact that they don't know about the business of dentistry and how that could impact our profession, because at the end of the day, we still have to run businesses, right?
Can I tell you, our audience is going to really not love this. I got such hate mail.
Oh, did
not
you?
only a couple things, but I had a whole rant on this on one of the intros about we need to stop doing, or maybe it was a tip episode or something. And they're like, Andrew, we're in it for this is our time to shine. We've been crapped on for so long in the profession, and blah blah blah.
I agree with that to an extent, right? I mean,
Sure.
It's
time for an upgrade.
And I wrote an article about that a year or two ago about the fact that, the pandemic actually was a benefit for hygienists because it allowed us to see we had been at a salary cap when I graduated, I was pretty much making the same amount of money for 10 years doing clinical hygiene, right?
Right.
So, and so it's the same. I didn't see an increase in my, in my experience, right?
Yeah.
So I think that, 2020 did, and we did get to see that. But now it's like, well, those people that have the experience, like myself, 17, 18 years, right? They're coming out and wanting to have more. Than what that I'm making. And I have 18 years, and here's what the person was saying earlier.
Yeah.
And I was like, you make a good point. She's like, because if they come out with that, then what is that going to make it later? There's, once again, what's going to happen is we're going to end up
Stagnant.
and then we're going to be stagnant again for another 15 years.
Yeah.
So, you got to leave some growth. And then, two, how are some of these doctors and how are some of these places being able to afford it, considering that we haven't seen an increase in insurance rate. Matter of fact, insurance rates have gone down.
Yeah.
They're going down, the payments that they're receiving and things like that. So how do we, protect our profession, protect that from happening? And what are some other ways that we can, talk with our offices to help in that area? Or what things could we do?
The $10,000 sign-on bonuses, we'll give you $30,000 to pay for your education that you just completed. We'll give you, in Iowa right now there's a last dollar scholarship, which anything that you don't qualify for, since hygiene is what's considered a high need public profession, anything that you don't qualify for state or federal aid, it's covered by the state.
Wow.
So it's called the last
cool.
dollar
Nice.
scholarship
Nice.
for Iowa residents.
You hear that, guys out there? Go to Iowa.
I know, right?
They need
I
hygienists.
don't like to talk about Iowa because it's like a best kept secret.
Well, it
You
looks
don't
beautiful.
you always talk about Iowa.
I don't like to tell too
That's
much
all
though
you-
because it's like the land of milk and honey.
You
We
don't
don't
want to
want
get-
population
It's only 5,000 listen to this, don't
influx.
worry.
We don't want population
Well, look,
influx.
you want providers, but you don't want population?
I like my quiet.
Hello.
She wants all resumes to get into Iowa going through her, and she'll hand select a few people to come to Iowa.
There's nothing wrong with that. No.
I love that.
I will say she's pretty fun to hang out with.
Oh,
so.
thanks, buddy.
She's a great hugger.
I am
Makes vanilla extracts.
I do. Okay. I lost my train of thought.
Okay, so going back to what you were saying, so here's the issue with all of that is there's no objective way to do skill assessment. So if I was the owner of a company, I would pay a provider more based on what they can do. If a doctor is doing molar endo and implants, I'm going to pay them accordingly, right? Not all doctors have the same scope that they feel comfortable working in. And similarly, hygienists, if you are a hygienist that's only going to do prophies all day long and nothing else, there's like a minimum rate. And then the more proficiency, I guess, that you do.
So you do
skill
sealants,
proficiency.
check. It's a point system.
Yeah.
If you can do sealants, if you do SRP, if you
Take
do
x-rays.
a certain amount of
Yeah.
perium x-rays. Really? People don't take it? Okay. Sorry, rewind.
Isn't that crazy? No.
Scans.
How many times have we interviewed people and they're like,
Yeah.
now do we have to take our own x-rays?
Oh, I hear
Are
that
you
all the
kidding?
time.
All
All
the
the time.
time.
I haven't
all
done it.
Stop
the
it.
time.
Where do I need to work to have
Yeah.
to
do I have to take my own
I
x-rays?
feel like that
And
is
we have
a
an
little
assistant, right?
An
Or, like,
assistant.
I mean, they're
What?
gonna help turn rooms over.
Where
and,
do you live? Like, is
in
this
Iowa.
reality?
Yeah, I think that's actually.
But
pretty
no, what I
normal.
remember my train of thought now. Like they have there's dentists offering sign-on bonuses and paying for your education and all this. And so I get these more seasoned hygienists, what I like to say. I've been around for 25 years. Who's going to give me 10 grand? And I always say it's like your cell phone company, right? You switch providers, maybe they'll give you a new phone and $50 off a month.
Yeah.
But that's a choice you have to make. Are you happy with your service or are you going to go somewhere else? So are you going to go for the sign-on bonus? And that's the volatile world we live in. And so I think it's actually a benefit for hygienists right now. Because if you're not being treated accordingly, if you're not getting your 60-minute appointments accordingly, then we say, excuse me, Dr. Andrew, can we stay after work today? And I want to have a conversation with you about my value to this practice. And I want to have a
Absolutely.
conversation with you about how I would like to have an hour for appointments. And I noticed that you're offering a $10,000 sign-on bonus. The doctor up the street is offering that too. And if you give me $5,000, I'll sign a paper that I'll stay for 2 more years.
Look at you.
And you need to have
negotiating.
negotiation
Dr.
skills.
Smarts right
I
there.
know.
And you need to turn down the sassy and turn up the rational.
Yeah.
And I have this theory that calm replaces chaos. And I learned
Yeah.
that about 10 years ago in my life. Because I still talk a lot, but I used to be very reactionary. And now I'm like, okay, let's step back. Let's try this your way. Let's talk about this like 2 people that can talk about something. And I think especially when somebody like me that's very, very high energy does that, then people are like, whoa. Like they almost lean into, what is she? But having that conversation, you have to know your own value.
Yeah.
And you can't go to the doctor and say, what do you mean you're offering $10,000 sign-on bonus? You have to say, no, let's have a conversation about
Let's
this.
talk about this.
There you go.
And I think even, and I'm sorry, Miss, I believe also in that same standard, hygienists that have been working for many years in a particular practice, maybe they're getting paid whatever, X amount, let's say $30, $35, $40. You could even create your own type of program with that dentist to see if they could get increases based on the services they're giving to their patients.
Oh, absolutely.
So that's a way of doing it, even though they've stayed with the $40 an hour, but other initiatives that could help them get more money throughout the process.
For sure.
Oh, yeah. I think that they could definitely have a conversation like that with their doctors. Like I said, once again, it goes back to we teach people how to treat us.
Mm-hmm.
You do it? You gonna sneeze? Do it?
Feel like it. I
Do
feel
it.
like it.
Make
What
it
are you
count.
supposed to say? Elephant, elephant, elephant?
I always
And
look
it's
at the
supposed to-
light
or look at the light like you
and
look
say
at the light and
watermelon,
say,
watermelon.
See, I thought it was
Watermelon.
elephant. Yeah,
That's
you look
when
at
I
the
sing.
light and say
Watermelon,
elephant,
watermelon,
elephant. Or
watermelon.
I'll
Who
say
are these
watermelon,
people?
watermelon,
The
watermelon.
weirdest thing.
You have to say watermelon.
Hey, it worked. I didn't sneeze.
No, you did a great job. All right, so let's do this. One last
This
message.
poor podcast.
No, this is awesome. One last message to the audience, a short-ish message. Message?
Mensaje.
A short mensaje for our audience. Things that, because they don't, Boge's been on several times and Rafael's been on a couple times. But Misty, you haven't really had a voice on this podcast yet.
No, it's my first time.
But anything that you feel like along these lines that we need to be thinking about as hygienists?
Technology. We need to be looking at technology like
Yeah.
CBCTs, scanners. We need to, like I said, our profession is growing, and we need to be more adverse in those technologies. Even AI. I mean, that's something that they should be learning about, the new AAP guidelines, and really be familiar because dentistry is changing. It is. And, digital, I mean, I just saw a practice recently that had paper charts, but eventually that's going to have to go away, right? And so people need to be more adverse on, the computer programs, being able to use the computer, even QR codes, different things, utilizing those to be able to educate your patients. But technology, I think, is really where we're headed. And I think over the next 10 years, we're going to really see dentistry change. I really just feel it in my heart of hearts over the next 10 years. And I want hygienists to be at the forefront of that change.
Yeah, and if you go back, all the hygienists out there, they're seasoned hygienists, and going back to that pinning ceremony that we all went through, if you guys remember that pinning ceremony, where you had to kind of read that oath of what your profession is all about and what you stand for to continue to grow and develop and grow in everything you're doing, not continue staying stagnant. So if I go back to 1990 when I graduated, which I kind of dated myself now, at that time it was all about if you see tartar on the x-ray, that's when you do scanning and root planing. If you don't, you didn't do scanning and root planing because it was all following that process of what that was at that time. Now we know it's all about bacteria. So it's not about that seeing tartar. It's about destructing that bacteria in that pocket and making it happen. So it's all about continue to evolve and grow and just don't stay behind in the information that you are just because you're in this little box in that particular office that maybe there's no other way out. You're just there. Grow and develop and create value for your profession. That's the only way that us as a profession are continue to grow in who we are, and people are going to respect us out there.
Oh, yeah, and I think there's going to be more of a need for hygienists over the next 10 years as well because you're going to continue to see links that really put periodontal disease and things like, for instance, those people who have periodontal disease are 9 times more likely to get COVID, right, to be hospitalized from COVID and be on a ventilator. You're going to see Alzheimer's. So you're going to see so many more diseases that are impacted by the mouth. And I joke and I say this, but it's true. You can't spell overall health without oral health.
Yes.
Right? And so you have to be able to, and I think we're going to see that change. And right now what we're talking about, this is our way to be able to make that change and be a part of it. So I think that we just have to continue to do that and hear our voices and not just us, but all hygienists. And really that's just a call to all hygienists to get out there and, have a level of professionalism, uphold the standards of care for our patients. And, because change is coming and we need to be on the forefront of that.
That's right.
So biofilm existed in 1990?
It did, but we
that.
didn't talk about it too much. I mean, it was there. We learned about it, but it
was
was
it
all
there?
about the
It's like
culture.
kind of like, was the world round before? Like
No,
we thought it was flat.
It was flat at
and
one point. Remember?
That's what I want to say to some of these folks. Like, well, I do a radiology course that I do in a lot of different states for certification. And these dentists will tell me, no, when you bend the old films and the Elon reflection, and I'm like, Okay,
Wow.
you can think that if you want, but the world is still round. That's what I want to say.
Oh.
And it's interesting to me, things like AOSH. I talk about AOSH. And there's people in dentistry who don't know what it is. The American Academy of Oral and Systemic Health. And I just went to the meeting last month in Chicago, and it's been on my mind since I left that meeting. 16 speakers in 8 hours. And I feel like I'm doing a commercial here a little bit, but the things I learned in that meeting in those 8 hours for free, I paid no money for that meeting. And it just it made my head you know, and the things that we don't know, the things we don't know now, I feel like if I still practiced like 2003 when I graduated from hygiene school and I still had those same opinions, like a lot of people who are out practicing have the same opinions from 40 years ago when they were in dental school. So I guess my takeaway is education. And I'm not talking education like I just got my doctorate education. I don't think everybody needs a master's. I don't think everybody needs a doctorate. I'm talking basic education. Like, there's so much free out there that, you know, people are sitting at home at night watching Netflix. Do you know how many programs Colgate has on their website for professionals?
We just need to get a Netflix channel.
That are brand new. Heck
right?
yeah.
That's the answer.
Solved everything.
Right?
Yeah,
Where's
that's
the sound with it?
You did it.
But seriously, people are sitting at home, and I mean, I'm guilty of it. I love me some Yellowstone, but why all this free information? Why is no one paying attention?
Right. You know, talking about like educating the public and Netflix, I have an idea, but I don't know how we could pull it off. Has anybody ever watched the documentary Say Ah? Oh, you have guys have not watched it. You got to watch
write
it.
that down.
Say Ah. It's on YouTube.
Yeah.
But getting that on Netflix would be amazing. It's an older one, so the hairstyles, I mean, is back. But it goes to show that, like, you know, years ago, I don't know when it was produced, but it takes individuals through kind of their journey and how their periodontal disease impacted their life. Like, one wasn't able to get pregnant and have babies. One ended up having cardiovascular disease. It really walks through, and it talks about, it's these actual medical doctors are saying, it's kind of their ploy to dental professionals to say, like, we need you guys to do, and it's not just about dentistry, it's about, you know, being part of the care model. And
that's the cool thing about AOSH is, you know, there's medical doctors there's dentists there, there's oral surgeons there's hygienists, there was assistants that spoke.
It actually might be by them.
Yeah, I need to look into that. And it reminds me like the What If Saliva Was Red video from the early 70s that they redid.
Yeah.
I love that video because I can play that video, like just a small clip of it in a CE, and I can understand the people in the audience that aren't creeped out when the guy goes to get the phone with his bloody hand. And like then you have these less seasoned hygienists in the audience that are like, what is on that phone? Are those no, my gosh, that's a dial on a telephone.
What is that?
And so like you see the generational differences in the audience when you're lecturing in an infection control class, because you almost wonder, is this the first infection control class that more seasoned dentist has been to in 30 years? Like you look at them like, oh, I'm totally non-phased by what just occurred on the screen. It blows my mind.
That's incredible.
All right, everyone. Thank you so much for being here. I appreciate you guys helping me figure out all the world's problems and solving them in one podcast. So if people want to reach out to you, how might they reach you?
Emily Boge, Emily at thinkbigdental.com, or Hawkeye Community College, Emily.Boge at hawkeyecollege.edu.
And I'm Misty Mattingly, and you can reach me at mistymattinglyrdh@gmail.com.
And I'm Rafael Rondon, Mr. RDH. You could reach me at mrdh1993 at gmail.com.
Awesome. Thanks for being here.
Yes.